Okay, so here we have the heart. This is a model of the heart, human heart. The first thing we're going to talk about is the apex, which is this pointy area right here. Then we have the base. The base can be the back here. This is the base of the heart. And then you have this broad portion of the heart here, which some professors would also consider part of the base, but as the main portion of the base is this back part right here. Then we have the superior vena cava, which is this vessel right here. And you have the inferior vena cava, which is this vessel right at the bottom. Then we have the aorta, which is this red vessel. It's the main vessel, and it's an artery. Okay? Now there's three parts to the aorta. You have the ascending aorta, the aortic arch, and the descending aorta. The descending aorta goes down, the ascending aorta goes up, and the aortic arch is the portion that curves on the aorta here. The aorta has three different branches. You've got the brachiocephalic artery, the left common carotid, and the left subclavian. The way I typically tell students or teach students this is to use an acronym or a mnemonic device. Broward College sucks. So the B is for brachiocephalic artery, the C is for left common carotid, and the S is for left subclavian, right? Okay, so that's good. Then here we have the pulmonary trunk. That's this area right here. Then we have this distorted ear looking area, which is the right auricle, and this is the left auricle. Now before I move on to any other structures, let me give you a few pointers as to how to orient yourself when you're looking at the heart. How do I figure out which side is the right and which side is the left? Well, the one thing I say to students is the right side of the heart is always going to be on the same side as the superior vena cava. So if you see the superior vena cava, it's going to be the right side. If you don't see the superior vena cava, it's the left. So this is the right side of the heart, and this is the left side of the heart. Now, if you open it up, you can see, wish me luck opening this up, but before we do that, before we open it up, let's go over these vessels right here. Now, remember how I said this is the right side of the heart, and this is the left? So, if we turn this way, we have the right pulmonary arteries, and these are going to be right pulmonary veins. So the red, in this case, are going to be the right pulmonary veins, and these are going to be the right pulmonary arteries. This is not always the case, but this is an exception to the rule. And then on the other side, you're going to have the left pulmonary artery and the left pulmonary veins. Okay, so we got that down. Now, if we open up the heart, we have four chambers here. We have the right atrium, then you have the right ventricle, then you have the left atrium and the left ventricle. Now, in between the right and left, in between the right atrium and the right ventricle, you have a valve, which is this one right here, which we call the tricuspid valve. It's also known as the right atrioventricular valve or right AV valve. It just it controls the amount of blood that flows from the right atrium into the right ventricle, okay? Now, you also have these little strings right here. These are called tendinous cords. If you want the Latin, it's called cordae tendineae. Okay, so in English, it's tendinous cords. In Latin, it's cordae tendineae. These cords actually attach to a muscle that we have in the ventricle, which are the papillary muscles. Okay, so see how this one is attached? The other ones are not attached because it's broken. This model is a little old and damaged. But anyway, they're supposed to attach to the papillary muscles. Then on this side, we have the, can you see that? This is the left AV valve, or the left atrioventricular valve, which is also known as the bicuspid valve, or mitral valve, or again, left atrioventricular valve, or left AV valve. Okay, so that's this little area. Then you have again the chordae tendineae, or tendinous cords, which in this case are attached to the papillary muscles here. Then in between the two ventricles, again just to recap, you have the right and left ventricles. In between the two ventricles, you have the interventricular septum, just like the septum in your nose, which separates your nostrils, right? You also have the interventricular septum. Now, right here, we have another valve that's called the pulmonary semilunar valve. The pulmonary semilunar valve leads into the pulmonary trunk, which we have mentioned earlier. We also have, on the left side, we have the aortic semilunar valve, which is this right here. Okay? So, pulmonary semilunar valve, aortic semilunar valve. Now, let's talk about the layers of the heart. You have three main layers. You have the epicardium, which is the outermost layer. The epicardium is also known as the visceral pericardium. Okay? Then you have the middle layer, which is the muscular layer of the heart, which we call the myocardium. Now, if you remember from A&P1, the prefix myo means muscle, so that's why it's the muscular layer of the heart. And then you have the endocardium, which is the innermost layer of the heart, so it's going to be on the inside. There are other things that I will teach you later on as far as when we get to the outside of the heart, that I'll leave that to another video. Let's just recap the layers again. You have the epicardium, which is the outermost layer, the myocardium, which is the middle layer, and the endocardium, which is this layer on the inside here. Okay, so if you see a layer on the inside, it's going to be the endocardium. And that's the end of this video.